Hi, my name is Natalie Krebs, and I'm here to discuss a procedure known as a stereotactic breast biopsy. During my discussion, I want you to learn what the procedure is and what you should expect to happen during the process. A stereotactic breast biopsy is used to diagnose issues in women and men's breasts when a potential problem is discovered. The breast issues can be deposits of calcium in the breast, changes in the breast and nipple structure, pain or lumps within the breast. In addition, another issue is the presence of lactation in the breast tissue when the patient is not showing any signs of pregnancy. All these symptoms can be signs of cancer. Specifically, a stereotactic breast biopsy is a medical procedure that uses x-rays of the breast to determine where to inject a needle into the breast tissue to get a biopsy taken to check the sample for irregularities. The procedure will be done using a technique called stereotactic technique because it utilizes two x-ray images taken from different angles at the same location of the biopsied area. 4 questions that the patient will be asked to do during preparation for the procedure. They will be asked what their symptoms are, what medications they're on, and if the patient is possibly pregnant. Then the patient will be asked to remove any jewelry, glasses, or any metal in their body. Next, the patient will undress from the waist up. Typically, the procedure can take 30 to 60 minutes. The patient in the exam room will have the patient lie down either sideways or on their stomach on an exam table with a hole in it. The patient will put their breast tissue into the hole. The exam table will raise the patient higher, and a specialized mammography machine will be used. The mammography machine has 2 metal plates that surround and compress the breast tissue to allow the radiologist to take x-rays. After the x-rays are taken from the area concerned, the radiologist will administer anesthesia, access the breast, and make a cut into the breast tissue with a scalpel. Subsequently, the radiologist will use a core needle or needle probe with a vacuum to go directly to the area of concern. Next, the radiologist uses the coordinates from the computerized x-rays to take out several sample cells. Following this, the technician or nurse will apply pressure for 5 minutes with surgical gauze and tape to the sample area to prevent excessive bleeding. Sometimes the radiologist can place a medical marker in the sample area in case it is cancerous and more tests need to be done. Also, the radiologist sends the sample to be tested for cancer cells or growths by pathology. Luckily, stereotactic biopsies do not require the patient to get any stitches. The patient can have post-biopsy symptoms such as slight pain, swelling, and bruising. Depending on the results, doctor can form a diagnosis. When the sample turns out to be cancerous, the biopsy will tell the doctor whether cancer has been formed from hormones or what specific type of breast cancer it is. The risk of the procedure is that the patient can experience fever, severe swelling, and redness of the breast tissue. If the symptoms occur, the patient should contact their doctor in case of infection. The benefit of stereotactic breast biopsy procedure is that, unlike in the past when doctors had to perform the surgery to get a biopsy, the patient can have a biopsy procedure done in a timely procedure and be on their way. The patient will be able to receive an accurate diagnosis and be able to catch possible breast cancer early and receive a treatment plan.